I went to medical school in Wake Forest. I'm familiar with the area, and that's kind of what brought me back here, ultimately to continue with my career. I went to Brigham Young University for my undergraduate degree, where I studied neuroscience. For the last 5 years, I've been at the University of Utah, completing my otolaryngology head and neck surgery training. I studied neuroscience in undergrad, and that was of particular interest to me. And I did some research actually at UCLA and both at BYU in neuroscience, so I was always kind of interested in that. When I got to medical school, as a natural extension of that, thought I'd be interested in neurosurgery. But along the way, I did a rotation on ear, nose, and throat and head and neck surgery, and really fell in love with that. Ear, nose, and throat has a great breadth to it. There's so many different things that we cover, and so many different things that we are able to treat. And so that was of particular interest to me. And there's also a lot of depth in the field as well, and there's a lot of opportunity to really get focused on certain things and certain disease processes, which was interesting. I've always been very interested in surgery and kind of the hands-on approach to medicine, and being able to help people somewhat quickly, and that's always kind of drawn me to the surgical fields, because often there's a problem and there's a solution, and through a surgical intervention you can help people improve their quality of life. So that was of particular interest to me. I'm a bread and butter general ENT. I treat everything. I'm interested in everything. The most common thing that I would probably see are ear infections in ear tubes, which we most commonly do in children, but in adults as well. Probably the second most common thing would be either recurrent tonsil infections, tonsillitis, and the accompanying tonsillectomy. Other areas that I've been trained to treat are ear conditions, so perforations of the eardrum or holes in the eardrum and reconstruction of that, chronic ear infections, sinus problems, so chronic rhinosinusitis and acute sinusitis, and endoscopic sinus surgery. One of the things that we'll do in our practice is obviously diagnose particular allergies, whether they're seasonal allergies or they're environmental allergies, and then tailor a treatment for that. Also facial plastic surgery, so a lot of people don't realize that within the field of ENT, we're trained in facial plastic surgery. My patients are my family, and I treat them the way I treat my family members. I want to offer the best care that I can. I'm a surgeon. I love to operate, but I think the most important thing that I can do as a surgeon is not operate on people that don't need to be operated on. That's a core philosophy of mine, and my interest in education and continuing education is very strong, and so I'm always interested in learning the new things and the new techniques, and attending conferences and continuing to develop myself professionally, so that I can continue to bring the highest level of healthcare to my patients. Yeah, during medical school at Wake Forest, I had the opportunity to work in this area. For the most part, I was in Lenore, and I worked there over the course of the 4 years that I was in medical school, and really kind of fell in love with the area and this kind of Blue Ridge area. I love the kind of rural setting and the outdoor opportunities that we have here, and so one of the first things I did when I was approaching graduation from my residency was to look here in this area, and fortunately that worked out wonderfully for me, and this was my top choice.